We start with today being the busiest day yet at the state's largest COVID-19 testing site. That is the Pepsi Center. The wait time grew up to an hour and 20 minutes for some people, but normally city officials say it takes no more than 3 minutes. The executive director for the Department of Public Safety tells our 9 News reporter Sonia Gutierrez they've been seeing a big influx of people getting tested.
So far, the Pepsi Center has tested over 39,000 people.
That number grows every minute.
Add to that a holiday weekend.
We are just seeing astronomical numbers the last few days, I would say in the last week.
Executive Director for the Department of Public Safety, Murphy Robinson, says that today has been the busiest day yet.
Because of the influx of people that we're getting, we are having to shut down earlier because we can only test up to 2,000 people a day. And so if we reach that capacity before 4 o'clock, we will shut down before 4.
2,000 is a capacity because they want the lab results within 4 to 5 days.
What we're seeing right now, because of the influx, not only in Denver, but across the nation, we're seeing quite a few people that are seeing their labs turned around a little bit later than that.
With the influx of people, including out-of-state folks, the holiday weekend, and the mandatory furlough day on Monday for the city, he says results are taking longer.
So give our lab partners some grace during the holidays especially, so that they can catch up.
He says the Pepsi Center is not a permanent testing site. It was an emergency response. While they're happy to provide this service, the reality is they must think about the future.
It's important to note that we are having the conversation now as we speak to talk about the longevity of the Pepsi Center site, as well as how do we make sure we're serving Denver residents the way they need to be served.
For 9 News, I'm Sonia Gutierrez.
Murphy Robinson also telling 9 News that they're working with their partners on the next steps for Pepsi Center, how to make sure that they have the right capacity, the best information for people, and how to make sure that people there are, in fact, getting tested.